Welcome to the Bronchiectasis and NTM Association podcast, where we're here to share valuable insight from leading health experts, heartwarming stories from people living with bronchiectasis and NTM lung disease, and the latest in health research and treatment. Please subscribe, follow us on social media, and visit bronchandntm.org to learn more. Just a quick note before we get started. This podcast series is intended for educational purposes only and is not suitable for medical advice. Please consult your medical provider if you have any questions. Welcome to today's podcast episode where we honor World NTM Day. Joining us today is Dr. Ashwin Basavaraj. He is the Associate Director at NYU Langone Health and discusses one of the most important parts of living with bronchiectasis and NTM lung disease, and that is airway clearance. He explains what airway clearance is, why it's important, what can happen in the lungs when mucus is not cleared regularly, and how clinicians can tailor airway clearance plans specifically to you, depending on what your disease severity is, other health conditions, and even lifestyle. Dr. Basavaraj also reviews safety tips, warning signs, and shares practical ideas to stay motivated and consistent over a long period of time. In honor of World NTM Day, he closes with a key message for those living with NTM lung disease. So welcome again, Dr. Basavaraj. It's so nice to have you today.
Yeah, thank you. And happy NTM Day for all those that are listening. I'm Ashwin Basavaraj. I am Associate Director of our Bronchiectasis and NTM program at NYU Langone Health and Section Chief of Pulmonary and Critical Care at Bellevue Hospital, which is our public hospital affiliate with NYU. We both are proud to be sites for the National Care Center Network through the Bronchiectasis and NTM Association. So happy to be.
For someone newly diagnosed with bronchiectasis and NTM lung disease, how would you explain what airway clearance is and why it's so important in this population?
Yeah, that's a great question. And I think to understand what airway clearance is, it's important for patients to understand what bronchiectasis is. And what bronchiectasis is in airways that are irregularly dilated for a number of reasons. And when that happens, mucus becomes difficult to clear out of those dilated airways. And when mucus gets stuck in those airways, that can lead to repeated infections and chronic infections, most commonly non-tuberculous mycobacteria or NTM. That can lead to inflammation as well. So it's important to try to get that mucus out of those airways and out of the lungs to reduce the infectious burden and the inflammation that can happen in bronchiectasis.
So what can happen in the lungs over time if a person with these lung diseases don't actually clear their lungs regularly?
Yeah, what can happen is there could be a worsening of their lung disease and their bronchiectasis. There's a classic model of bronchiectasis that's often discussed, and that's the vicious vortex model, where there could be repeated inflammation, infections, and further lung destruction. And when mucus is stuck in those airways, that can perpetuate that vicious vortex, which leads to worsening of their bronchiectasis. So it's important with airway clearance to try to get that mucus out of the lungs to disrupt that vicious vortex and try to prevent further bronchiectasis in the patients.
And when we look at an individualized plan, how do you decide which airway clearance method or device would be best for a particular patient?
Yeah, it's a good question. And the way I like to think about that is geographically based. So for example, in other parts of the world, such as Europe, they have much better access to chest physiotherapists in their countries. So they often utilize some of the manual techniques taught by chest physiotherapists as their first line of airway clearance. In the US, our access to airway clearance physiotherapists and pulmonary rehab is limited. So we oftentimes classically start with an airway clearance regimen that includes nebulization with hypertonic saline and a positive expiratory pressure device, and that's recommended twice daily. And if that doesn't help relieve mucus, there's other options too. So for example, adding on high frequency chest wall oscillation devices referring to chest physiotherapists if there's access, and performing some of the manual exercise techniques, which they can do at home.
So do you take things into consideration when you're, for example, a person's age, maybe the severity of the disease, if they have any pre-existing medical conditions, or even what their lifestyle is? Does any of that influence your recommendations?
Yeah, it's important to take the patient's preferences into account. Each individualized patient is different, and they have, different lifestyles and, different time commitments. And some, patients who may be, older age may not be able to utilize some of the devices. There's other considerations such as travel and such, and portability. So it's important to incorporate the patient's preferences, because that will lead to improved compliance with their airway clearance regimen. But a standard regimen is usually the nebulized saline and a positive expiratory pressure device to start out with. And if patients can't incorporate that, or if they have difficulty utilizing those techniques, we'll try to offer some other strategies to help improve their compliance with airway clearance.
I bet the best airway clearance is the one that a person can stay consistent with, and making sure that they're consistent on good days and bad days. Would you say that's correct?
Yeah, absolutely. And I think, there's not a lot of research out there comparing the different modalities of airway clearance and, which one is better than the other. So we oftentimes tell our patients exactly what you just said. And that's, the most important airway clearance technique is the one that the patients will use, and the one that benefits the patients the most. If they're using an airway clearance technique that is bringing up more mucus, we'll encourage them to stick with that technique. And if they're utilizing an airway clearance technique that's not really helping, we'll try to find something that really works for them. But, it's important to bring up mucus. That's the goal with airway clearance and bronchiectasis and NTM.
So would you say that's the best way to tell if your airway clearance method is working for you, is if they're bringing up mucus? I know that there's a lot of patients who we see in the social group that we have through the Bronchiectasis and NTM Association that they say that they have trouble bringing up mucus. Is that because it might be that they have that, I've heard the term dry bronchiectasis, where they don't produce a lot? Or is it maybe that their performance on how they are doing the method isn't working?
Yeah, it could be a number of reasons why patients can't, bring out mucus from their lungs. Oftentimes they may need some proper instruction on how to utilize the modalities. There's good websites that patients can use to reinforce how to use some of these techniques. So, for example, the chest bridging website has some good video instructions on how to utilize airway clearance techniques. The Bronchiectasis Toolbox is another website as well that has good video instructions. But one way to try to tell if patients are able to bring out mucus is if they physically notice that mucus is coming out after they perform their airway clearance. And another, great way is to look at their CAT scan. With bronchiectasis, we have, mucoid impaction and mucus that's stuck in their lungs that we can see on their CAT scans. Repeating that over time to see if we're making improvement in the mucus plugging, is another way to try to see if we're making progress.
So would it be something that if a person is doing airway clearance and they've been doing the same airway clearance for a long time and they just feel like they're not producing enough mucus, is it ever a possibility for a provider then to do another CT to see if anything has changed?
Yeah, we always can do CTs. We always have to take into account what the risk benefit is, with CTs. We want to make sure that we're getting it at a time interval that makes sense, that we can see enough change. We don't want to get too many CTs and add, the radiation cumulative dose on there. So we want to take that into consideration. But if clinically, if there's a reason to suspect, whether there's improvement or whether there's worsening, and we want to try to see, if we can document that on the CAT scan, then yes, it makes sense to get a CAT scan to see, if there's been a change in their mucoid impaction.
So how often do you typically recommend that a patient perform airway clearance, and how might that change over time as they kind of progress through the disease, as well as if they have an exacerbation or flare up?
Yeah, so what the guidelines suggest and what the classic recommendations are is performing airway clearance, once or twice daily, but ideally twice daily is what's recommended. Now, realistically, patients may have difficulty fitting that into their schedules. It's not just a 10-minute exercise that they can do twice a day. There's, cleaning involved with the, equipment and the nebulization. So the time builds up. And it's not uncommon that I hear from patients that they can fit it in maybe once a day. And I really just encourage patients that, hey, as long as you're doing some form of airway clearance daily, that's the most important. Some sort of routine that they can stick with. And if they can stick with that routine, if it's helping them bring out their mucus, that's what's most important. And in terms of exacerbations, we don't usually change their airway clearance routine during the exacerbation. Oftentimes we want to treat the exacerbation appropriately and try to prevent the exacerbations with some of the newer anti-inflammatory therapies that are out there. But if patients are hospitalized for a bronchiectasis exacerbation, that could be one avenue where we can introduce some new airway clearance techniques that, for example, a high frequency chest wall oscillation therapy in the hospital where they may not be, have access to that at home. So those are ways we try to, fit in the patient's preference in terms of their airway clearance and schedules and exacerbations.
With airway clearance and kind of touching on the devices, but also I want to talk about exercise. So what if a patient is traveling and they can't bring some of their equipment with them, or they forget some of it at home, or some of it breaks and they don't have access to it? What would be maybe some exercise that a person could do that would help with airway clearance as well in that short term and even long term, how exercise and airway clearance could benefit somebody?
Yeah, even before exercise, we do recommend for travel, there's travel nebulizers that are out there that patients can utilize to help with portability. Obviously, positive expiratory pressure devices are pretty portable too. So we encourage them to try to maintain their airway clearance regimen with those portable devices as best they can. Now, in terms of exercises, there's different exercise and manual techniques that can be performed at home or when they're away during travel. And some of those exercise techniques are just manual chest physical therapy, where there's someone else that's kind of tapping on their back to try to loosen up the mucus. There's active cycle breathing technique, which involves a series of breaths and coughing to try to mobilize the mucus from their lungs. There's autogenic drainage. So there's different exercises that patients can learn from, either through the videos or through sessions with the chest physiotherapist, and they can, take with them when they travel to try to perform their airway clearance as best, as possible away from home.
So you kind of touched on this with that last question, but with manual techniques, you talked about the active cycle breathing, autogenic drainage, huff cough, all different ways that people can do these and focus on the breathing pattern, the body position to help move up that mucus from the smaller to the larger airways and hopefully cough it out successfully. And then also the devices. So with those devices, can you just explain a little bit, maybe the categories of devices? So I know that there's many different types of devices out there, but there's kind of certain categories that they kind of fall into.
Yeah, there's a lot of modalities that are out there, but some of the common ones are, for example, through a nebulizer utilizing saline. We most commonly start with 7% hypertonic saline, which is extrapolated from the cystic fibrosis literature. But if patients have difficulty tolerating 7%, we can either pre-treat with albuterol to try to minimize any sort of bronchospasm or intolerance that the saline is causing, or we can back down on the concentration from 7% to either 3% or 0.9% saline. So that's one modality that patients can utilize. Another one is a positive expiratory pressure device, which creates a little resistance in the airways to create vibrations to try to help break off the mucus, and patients can cough it out. So, a very common regimen is utilizing the hypertonic saline first, followed by a positive expiratory pressure device. There are other modalities such as high-frequency chest wall oscillation therapy, which patients can wear and then plug in the device that shakes up the chest to try to loosen up the mucus, and then they can cough it out. So those are some of the modalities and devices that are most commonly used for patients, with airway clearance techniques.
So devices, essentially, from what I'm gathering, some can create the back pressure. Some have some oscillation or rapid vibration in the chest to help mobilize that mucus, and even external vibration through that vest that you were talking about, that external vibration to help loosen up and move that mucus, kind of shear it off of the airway walls. So I want to talk about safety and some red flags. So what would be some symptoms or warning signs that a person should stop airway clearance or maybe contact their healthcare team?
Yeah, so very commonly what we see in patients in bronchiectasis itself, but also for those that may be using airway clearance, could be a little blood streaking in their sputum or hemoptysis. And this is a very common, call that I get from patients if they are, having hemoptysis. What should they do? And usually our first step is holding the airway clearance, because sometimes these devices and modalities can be irritating to the airways. Patients are really trying to do such a good job in clearing out their lungs, sometimes that they can overdo it and irritate the airways, and that can lead to a little blood streaking. So, our first step in that scenario is to hold the airway clearance, let the hemoptysis subside and maybe restart some of their airway clearance a little bit lighter, maybe backing down on the positive expiratory pressure device to a lower setting, so you're not causing as much irritation to the airways. The bronchiectasis itself can cause hemoptysis, and infections can cause hemoptysis. So if holding the airway clearance doesn't resolve the hemoptysis, we may recommend antibiotics or other interventions. But usually that's a very common signal to hold the airway clearance when hemoptysis occurs, and we instruct that to patients whenever we're starting airway clearance.
So how do you support patients who find that airway clearance might be uncomfortable or tiring? Maybe they're just really discouraged by it. How would you help a patient work through that?
Yeah, again, I think it's important for patients to understand the importance of airway clearance. I think showing them their CAT scans at the start of when we're beginning airway clearance is a very important motivating factor for patients, because if they can see the signs of mucus, the signs of NTM infection or other infections on their CAT scan, and we review together that we're trying to clear up those findings on the CAT scan, it really motivates patients to work on that. So that's one way to try to approach dealing with, situations where, it may be a little bit uncomfortable for patients or unmotivating to use their airway clearance. And the other, important strategy is really working with patients and incorporating their preferences, not forcing any patient to do this twice a day when they just don't have the time to do it. Really working on what fits their schedule, what fits their lifestyle, what fits, what they can and can't do. And once we find that rhythm and really incorporate the preferences, of the patients, I think that really helps, with compliance with airway clearance.
Yeah, I really like that you mentioned having that visual, like that visualization, that visual feedback for people to see. I think that's really important when people can actually see this is what's happening in my lungs and have that image, and then knowing that the mucus that's coming out is that stuff we don't want to collect in there. What would you say a role of a respiratory therapist is in this situation? So I know you mentioned before how in other countries they have more, chest physio, or they have physical therapists and chest physiotherapy that they go through. And I know that that's not really something that is in all sorts of clinics. And I know that a lot of patients don't have access to that. And I just came back from a conference, and the most common question was, is I don't have a respiratory therapist. I wish that I had a respiratory therapist. So what would be the role of a respiratory therapist in helping with this education of the airway clearance devices and techniques?
Yeah, I think that's a great question. And, we as physicians and providers are limited with the time that we have to really teach airway clearance. We can introduce the topic, we can introduce what bronchiectasis is and review the treatment plan, but patients really need coaching and they need instruction on how to utilize these airway clearance techniques appropriately. So, the role of a respiratory therapist is that it's really, reviewing with patients how to use these modalities appropriately, teaching their loved ones in the clinic also, so they can, go home and reinforce, how to appropriately utilize these manual techniques and devices, and seeing them for follow-up, if they need a refresher in terms of how to, use these devices and these, exercise techniques appropriately. I think that's where the respiratory therapist really comes in, is really just teaching patients and their family members, appropriately how to utilize these airway clearance techniques.
So a little side note here, a really good way to get that feedback from a respiratory therapist, and then kind of a little bit of a self-plug here, the Bronchiectasis and NTM Association, we do have several respiratory therapists that are in the social group. So if you go on there and get into the social group, Bronchiectasis and NTM 360 Social, we answer questions in there too. And they have a lot of resources that you can click on, and it helps you to understand what it is that you're performing and the reasons why that it benefits you, as well as using YouTube and looking up and typing in what type of airway clearances that you're doing, just to get some positive reinforcement and feedback from, seeing examples. So I think those are really good if you don't have access to a respiratory therapist. So are there situations or conditions that a person might need to avoid certain types of techniques or devices?
There are, situations that are often quoted. So, for example, with high frequency chest wall oscillation therapy, one concern is there the possibility of fractures in the rib for someone who's elderly, who has osteoporosis. Personally, it's something I haven't seen before. It's pretty rare. But if those concerns come up, that might be one way to try to see if there's other strategies to help minimize those fears. If patients are actively hemoptysizing, we may think twice about some of these airway clearance techniques. For example, positive expiratory pressure devices. But really, there's very few situations where there is going to be an absolute contraindication to all of these airway clearance techniques. And it's so important to start from the start, utilizing airway clearance. So, really trying to reinforce, what the techniques are, and really trying to get into a regimen that patients can use is very important.
Are there any new emerging technologies or new approaches in airway clearance that you're particularly excited about?
Yeah, I think there are certain devices that have recently received FDA approval in the United States. So we are, excited to incorporate more devices and modalities to the regimen and increase our options, for airway clearance. So it's exciting that there's increased options. There's also research ongoing to gain data from these devices in the United States to see the benefits of certain airway clearance modalities. So a lot of exciting events that are ongoing in airway clearance and bronchiectasis that we can use to help our patients.
Yeah, I would definitely second that. I just came from a conference and I learned about 2 new pieces of equipment that are really exciting. One uses more of like a frequency to change the viscosity of the mucus. And then another one works on partnering with an app that they use autogenic drainage and that style of breathing. So I think those are really exciting to see where that goes. But these are kind of new modalities in the way that they work in the body. So that's exciting. Just to kind of bring it all back, many patients say that the hardest part is staying consistent. And staying motivated with the airway clearance over months and years. Can you give any words of advice on how they can bring in the family members and kind of bring in other people to help keep that mood lifted and have that positive reinforcement?
Yeah, I think, one is, including family members during the clinic visits with providers is very important because, there's so much information that's being discussed, during these visits. And, it's difficult for any one person to process everything that they're hearing during these visits. So, having family members at these visits is very important because, they can, pick up things that may have been discussed and, have that reinforced at home. Reviewing their CAT scans, as we mentioned, is a very important motivating factor. And, seeing over time if there's improvement, in the symptoms of patients, right? They may feel better by using their airway clearance. And I think that's important to keep track of. So those are some strategies to try to really incorporate, family members and compliance, with airway clearance.
Well, thank you so much for being here, Dr. Basavaraj. In honor of World NTM Day, what is one key message you would like to share specifically with people living with NTM lung disease about airway clearance?
Yeah, with bronchiectasis and NTM, airway clearance is key. It's often the first thing that we discuss with our patients. It's the first intervention. And for a lot of patients, that may be all that they need. Without pursuing aggressive antibiotics if it's unnecessary, or other, medical interventions. So if patients really can stick with their airway clearance, it may help their bronchiectasis and NTM, and that might be all that we need to do in a lot of patients. So it's really important for patients with bronchiectasis and NTM to utilize airway clearance and help prevent further progression of their lung condition.
Yeah, and I would say too, it's one thing that people can really take control over. We know that with having a chronic disease, you never know what tomorrow is going to look like. It kind of ebbs and flows. But with airway clearance, it's something that you can take control over. And if it's not working for you, to switch to something different. So really being your own advocate, doing the research out there, looking to see what new technology is out there, what you can do even without having some sort of device, even making it creative. Like, could you take up Taekwondo? Could you just walk up and down the street? Can you do some squats in your living room? So it doesn't always have to look like the standard thing. Different airway clearances can be from different exercise methods too. So just something to consider when you are exploring how to decrease that mucus or move that mucus out of your lungs. So thank you for tuning in to the Bronchiectasis and NTM Association podcast. We hope that you found today's episode helpful and inspiring. You can stay connected by joining our online community, following our social media, and visiting our website for more resources. And of course, subscribe to this podcast and join us next time for more insights, stories, and tips to help you live well with bronchiectasis and NTM lung disease. Until then, thanks for listening and be well.